The ethos of our company is very much supportive around the autonomy. So we give physicians a choice. I think our job as a leadership team is to make sure they have the tools to be able to have access to it. And as we're introducing some of these new tools, what I would say is probably less than 25% of our physicians are utilizing AI tools in the concept of what we're talking about. Now, do I think that they're using AI with ChatGPT and things like that across the board, even outside of their work? Yes. But I think in just the everyday workflow, just becoming a little bit slower to adopt, and not because the AI tools aren't available to them, but what we're seeing is a lot of the EMR systems are not equipped and developed to have that integrated successfully. So it makes it harder for them to even be able to want to use it. If that makes sense.
Mm-hmm. Mike, is that your sense?
Specifically, yes. Specifically with your open evidence, which is AI-based medical program, I think people are starting to use it. I've seen it, slowly, probably 25%. I think Christa's probably right. But it's not only physicians, APPs are using it. And if you've ever used it, it's pretty amazing. You could ask clinical question or clinical vignette. You could put in there that you have a 50-year-old female that has this, and upload tell them what lab it was, and they'll give you a differential diagnosis, again, within a matter of seconds, and not only for common things, but for rarer things. And that's sort of what I was inferring to with my comment with Aniket. We have now on our cell phones instantaneous knowledge to medicine that we didn't have 6 months ago.
Mm-hmm.
Yeah. I would say too, Praveen, when we rolled out GI Genius, which is an AI detection for early polyps, even that was met with a little bit of resistance. I think a lot of it is fear, right? Is this fear that it's going to replace the need of physicians? And ultimately, and I think Mike just said this, it's more of understanding how our role is supporting that moving forward. That was something that we rolled out collectively across the group, and there was a mixed reactions to introducing a tool like this. Part of it, it's new, so they didn't want anything to slow them down. I think the physicians that recognize the value of, what this actually helps them continue to develop is good for the patients. There was a lot more adoption there. Part of it, again, is just getting used to a new tool and a new workflow. But ultimately, we got there. But even that was somewhat slow to adopt.